Hello, and welcome to this roundtable discussion about the flu and flu vaccines. I'm Dr. Matt Seidel, the Chief Medical Officer of Women's Health Connecticut, and I'm joined tonight by other Women's Health Connecticut OBGYNs from across the state. Let me introduce Dr. Roxanne Abder, who practices in Trumbull, Dr. Marlene Jean Miller, who practices in the Hartford area, Dr. Liz Kelly from Danbury, and Dr. Keith Falter, one of our medical directors, and also from Danbury. Vaccines are always somewhat of a hot topic, but especially so this year with lots of publicity about the COVID vaccines that are in development. We hear that many people are uncomfortable with the idea of vaccines and might be hesitant to take a COVID vaccine. Now, with flu season around the corner, we are strongly recommending that everyone get a flu vaccine. And it is especially important for the more vulnerable amongst us, the very young, the older, and especially our pregnant patients. But we recognize that there's some discomfort with that recommendation. So we are here to help you understand a little bit more about vaccines, to learn a little bit about why they are so important, and to address some of the controversies surrounding them. We will talk about the flu vaccine, but we will also talk about the COVID vaccine, which will only be available after it has been carefully tested and subjected to the same scrutiny as every other available vaccine. And that process will take some time. So to start with, Dr. Abder, can you fill us in a little bit about the idea of vaccines and the history of their development throughout history?
Sure, Matt. So the way I think about vaccines is every time I park my car, I lock the door, I turn on the alarm. Not that I think anyone's coming to steal my car right away, but just in case someone was to come and try and break into my car, I want the alarm on. I want some form of protection. And I think about vaccines in a very similar way. They give our bodies a defense against the possibility of an incoming threat. As a mom and a physician, I think so much about the heartbreaking mortality rates that were faced, in the last century. In the beginning of the last century, 1 in 5 babies died in the first year of life. 20% of kids under the age of 5 died before they reached their 5th birthday. In addition, it was really commonplace to see babies gasping for air, kids in braces and iron lungs because of polio, and really devastating birth defects caused by viruses such as rubella. So vaccines have really been a major public health initiative that have changed the face of this. The earliest smallpox vaccine was developed in 1796 when a doctor in England by the name of Edward Jenner realized that milkmaids who had cowpox lesions, which looked very similar and were very similar to smallpox lesions, didn't get the smallpox when it came through their towns and villages. So what he did was he took a little bit of pus from a cowpox lesion and injected it into a 7-year-old boy. And then 6 weeks later, introduced this boy to the smallpox virus. And surprisingly enough, this young boy didn't get infected with smallpox. So over the years, clearly our techniques have gotten significantly better in developing vaccines, but the concept remains the same. A vaccine works by training the immune system to recognize and combat pathogens by triggering our own immune response. The advances of the last century have really been mind-blowing. Smallpox at the beginning of the 20th century killed 300 to 500 million people annually. As recently as 1967, the World Health Organization estimated that 15 million people contracted smallpox every year, and 2 million people died in that year from the smallpox. Now smallpox is all but eradicated through effective use of vaccines. The same thing is true with polio, where in 1952, 21,000 people were paralyzed from polio. And now the vaccine campaign has lowered this to less than 400 cases of polio annually. Measles has dropped 75% worldwide from 2000 to 2013. And similar stories can be told for rubella, diphtheria, pertussis. So we know that vaccines work and they save lives. And that's what's really changed the face of disease since the development.
Well, thanks, Dr. Adam. So Dr. Jean Miller, can you tell us a little bit about how they work?
Yes, I can. So vaccines, humans have two main parts to their immune system. We have what's called the innate system, which is what you're born with. And then we have the acquired or adaptive immune system, which develops as you're exposed to different bacteria and viruses during your lifetime. So once you have been exposed to a particular virus or microbe, then the immune system uses your white blood cells to fight off the invaders. There are different roles that the white cells perform. Some of them are responsible really for just alerting everybody else that there is now a new pathogen, a new virus or microbe that needs to be fought off. Others will actually go in and eat up or destroy whatever that virus is. And the last group will actually then take parts of the proteins from that virus and will form what are called antibodies. And antibodies are a memory cell, so to speak, that your body will create so that if it ever encounters the same bacteria, the same virus, it's able to remember exactly how it fought it off the first time, and it's able to replicate that same response so that you're able to fight off the infection. So vaccines work by imitating an infection, causing your body to create antibody cells without causing an illness. Some vaccines will last a lifetime, while others do not. This is because for some vaccines, you need more than one dose to obtain full immunity. So people who have young children, I'm sure you've noticed that there are certain times when you take your children to the pediatrician, they might have a similar vaccine spread out over several months or even several years. Now, other vaccines will work just fine the first time. However, over time, the immunity will start to wear off. And so for those vaccines, we'll usually get a booster shot to help your immune system rebuild its immunity to whatever that virus is. Lastly, other vaccines, such as the flu vaccine, actually need to be administered every year because the strain of the virus can change every season. So constantly, scientists are working hard to figure out and really predict which strain will be the most common for the upcoming flu season so that they can create a vaccine that will be helpful to prevent infection over the flu season.
Well, that's very helpful. Thank you so much, Marlene. Dr. Kelly, there's a lot of pushback and suspicion about all vaccines, not just the COVID vaccine. What are some of the arguments out there, and how do we respond to them?
Yeah, thank you, Dr. Seidel. I mean, you would think that social media was the proponent for a lot of people to spread rumor and innuendo, as it is for many other things, but this actually goes farther back than just the advent of social media. Some of the main reasons why people may oppose a vaccine, religious beliefs are often cited to be why someone would oppose getting a vaccination. However, it's worth noting that most religions don't oppose vaccines. They don't advise their congregants not to take the medical advice of their doctors. So this is something that's out there but doesn't have a lot of truth behind it. One of the reasons that people often cite is that there are other reasons why people have had less infectious disease aside from vaccines. So better sanitation and better hygiene in the 20th century are reasons why people don't get infectious disease as much as they otherwise would. And again, the science doesn't bear this out. Many studies have been done looking at how well people, how clean they are and whether this makes a difference for infectious disease. And I think COVID is a good example to show that people who might have good sanitation and good hygienic health practices, unless they're following the medical advice, in this case for COVID with masks and hand washing and gloves, can obviously contract COVID. Another misnomer or mistruth is that vaccines don't work and don't protect you because you may still get the disease. And so therefore, it's not worth it to get. Again, a lack of understanding of how public health and works is probably behind this falsehood, in that at an individual level, yes, we can find examples where either a vaccine didn't 100% protect a person or protect someone they know. But as a group, if a group of people are vaccinated, there is so much less likely to be any disease that's entering into that group of people, that overall the disease burden is lower and most people are protected. The next mistruth, that the vaccine itself will make you sick. I think we've just heard, excellent explanation of the science of how vaccines work. And your immune response to the vaccine is how your body is learning to recognize what the disease will be and how to fight it. And some people do get symptoms from that response, but that's not the disease itself. That's your body figuring out how that alarm, to use the analogy from earlier, how that car alarm should go off and how loud that alarm should be when the time comes. A couple more specific examples that people often point to, especially now in the news and social media that have come up in the last, 20 or 30 years, is the example that vaccines will cause you to have other problems that may not be recognized till later. The most famous one of these is around the suspicion that vaccines will give you autism, or that children can get autism from vaccines. This was specifically around the measles, mumps, and rubella vaccine. In the Lancet, a British journal, published an article a couple of decades ago that a scientist and many of his supporters published, saying that there is a specific gastrointestinal problem children will get as a response to the measles, mumps, and rubella vaccine, and that this will cause them to have autism. Unfortunately, because it's a prominent scientific publication and a lot of people trusted this publication, it has since been found out that the data that this person put forward, much of it was incorrectly gathered, and that in fact it was falsified, and that there was financial incentive to publish this data. And honestly, that's very damaging to medical credibility, and sometimes that happens, but we now know that there is absolutely no truth, no medical truth to that statement. But this feeds into a general mistrust. Other famous examples in history are the study with the Tuskegee Airmen and syphilis treatment, Henrietta Lacks, and the people who've seen the movie and read the book about doing cancer research based on taking samples from this woman, and the general mistrust that people are being used as guinea pigs. But real scientists, real epidemiologists take their work very seriously. And I think that over and over, examples, at least in the modern history, since Tuskegee, since Henrietta Lacks, and despite this Lancet publication, have shown that epidemiologists have the public health in mind, and that's the most important thing when we're talking about vaccines, and what I think we're going to talk about later with the COVID vaccine as well.
Thank you. I just wanted to talk a little bit, we're going to pivot a little bit to the flu vaccine now, and talk a little bit about why it's so important, especially for our pregnant patients. The problem with pregnancy is that in order to allow this house guest to grow inside you, your immune system has to be turned down a little bit to allow this foreigner, so to speak, to be inside. And therefore, the flu virus has an advantage. Many more patients get pneumonia from the flu during pregnancy than in non-pregnant patients. And sadly, pneumonia from the flu can be fatal. We all hear of people who have had the flu despite taking the flu vaccine. And that's true because the flu virus can mutate. And each year, scientists are making their best guess as to what flu strain will come along each year. But even if they don't guess correctly about the strains of flu that will be arriving this winter, those who get the vaccine will usually have a milder illness, even if they didn't guess exactly right. Many of us remember just about a decade ago during the H1N1 flu outbreak in 2009, we saw H1N1 was discovered coming at the last minute. It wasn't in the flu vaccine that year. And so that they were able to come up with a second vaccine that year to specifically target that H1N1 strain of the flu. And H1N1 vaccines reduced the risk of the flu in pregnant patients by 90%. It worked in 9 out of 10 people who got it. And their babies, the newborns of those vaccinated patients, had a 40% reduction in the amount of influenza. During other years, pregnant moms who received the flu vaccine had about a 35 to 40% reduction in the flu, and their babies had about a 63% reduction in the flu. The moral is that these really, really help better than not taking it at all. And in another large study, flu vaccine cut the cases of flu in half for the people who had it and dropped the risk of being hospitalized by 40%. So when the flu came along, it wasn't nearly as severe. And also, the pregnancies had better outcomes. There were less stillbirths in the mothers who were vaccinated and less babies that were small for dates and had other problems. The other important thing to remember is that being vaccinated for the flu can protect your baby. In addition to protecting yourself, flu vaccine protects the infant for several months after birth. The flu vaccine causes production of these antibodies, as Marlene explained, against the flu. And those antibodies not only protect you as the mother, but they cross the afterbirth, the placenta, to get directly into the baby's bloodstream, and they also cross through the breast milk. Babies don't get good at making antibodies right away, so they can't have the flu vaccine until they're 6 months old. But remember, we talked about the very young are very vulnerable to the flu. But the antibodies that come from the flu vaccine will help protect the baby at birth through the bloodstream, and then through the first 6 months from breast milk. So when you vaccinate yourself, you are vaccinating your baby as well, and that's important to remember. So, Dr. Falter, 2020 is obviously a very different year than any other in memory. How does COVID-19 affect our decision to get a flu shot, and how are they related a little bit?
Thanks, Dr. Seidel. There's actually a few considerations that we've made this year since the COVID-19 pandemic came around. A few people have been asking whether or not our actual flu shot itself is going to be different this year. As you had pointed out, the flu vaccine actually starts getting developed very early on in the year. So the preparation for our flu vaccine had started as early as January. A lot of times that's finished up in early spring. So our flu vaccine development was well underway prior to us hitting the peak of our COVID-19 pandemic. Each year, only about 40 to 50% of adults in the US normally get the flu vaccine. So given the concerns that we had this year with possibly hitting a pandemic of COVID-19 and our usual problems with influenza, there was a greater number of flu vaccines made this year, but it was roughly the same composition in past years of just looking at the strain specific for 2020. Some people have started to ask the question of, if I do get the flu vaccine, is that going to offer me any protection against COVID-19? So honestly, until this morning, I would have said no. But as we all figured out this year that everything with COVID-19 changes pretty much by the minute. There was an NPR article just this morning broaching this topic, and there was a suggestion from a virologist at the University of Maryland that perhaps getting the live version of the influenza vaccine may offer some protection. But please keep in mind, most people don't get the live vaccine. The live vaccine is the one that's done intranasally, where most of us get the influenza shot. It has been suggested from some of the data we've looked at that if you receive both influenza and COVID-19 at the same time, there may be an increase in morbidity and mortality. So I guess if you look at things in that manner, you getting the flu vaccine, protecting yourself from that virus may offer you some protection. And please always keep in mind that wearing a mask when social distancing is not possible can not only help prevent spreading COVID-19, but also influenza this fall. And speaking of social distancing, it's been asked, if I'm at home and I'm practicing social distancing, I can probably just skip the flu vaccine, right? Well, probably not. unfortunately, not everybody is social distancing right now. And we all have to remember how quickly our circles start to get bigger. If you have a child that's going to school, everybody that they're exposed to, they're then bringing home. If you or your spouse go to work, then same thing, whoever they're in contact with, it's then opening up your circle again. We all have to remember that we're getting later in the year, which means the holidays are coming up too. And as the flu is generally the most dangerous for our older adults and younger children, we're not just protecting ourselves, but we're protecting our loved ones in our life who are at more health risk than us. So much like wearing a mask, getting a flu shot is about your protection, but also about the loved ones in your life. The other consideration for flu shots this year in COVID-19 is if you do happen to be one of the ones who does come down with the COVID-19 virus, should you actually go get a flu shot at that time? And that's kind of a complicated and mixed answer. There's nothing dangerous about actually getting the flu shot at the time of having the COVID-19 virus, at least that we know of. But the CDC is currently asking people to not go for a flu shot just so that you're not exposing our healthcare professionals when you're sick. It's recommended that you stay home and you socially isolate until those symptoms are gone. And then once you're feeling better, you've been fever-free, you've been symptom-free per the CDC guidelines, then you're safe to go out and get your flu shot, because we still would like you to have it this season.
So I hope we've helped you understand a little bit why a flu shot is so important. I wanted to sort of go around the table and ask you all, what are some of the questions that your patients are asking you? For example, Keith, you mentioned the intranasal vaccine. Could you talk about a little bit about who's eligible for that and who's not?
Sure, and that's actually a great point, because it's not appropriate for everyone. Generally speaking, the intranasal live vaccine is appropriate for what we consider healthy, non-pregnant people who are between 2 and 49 years of age. It's generally not recommended for kids younger than 2, for anybody over the age of 50, people who have severe problems that lower their immune system, or any pregnant women. So it's not appropriate for everyone. I'd recommend that if you have any concerns about which is the right flu vaccine for you, please just ask your provider and they'll walk through the best and most appropriate one for each individual patient.
The one that we're using the most across Women's Health Connecticut is what's called a quadrivalent or tetravalent. In English, that means it's going against 4 different strains of flu. And so that's the one that we're recommending this year. There are also some consideration if you're allergic to eggs, and we use a separate one there. So ask your doctor or provider, and they will tell you the right one. Liz, people have asked a little bit about preservatives. Could you perhaps comment about that?
Yeah, absolutely. One of the concerns about drugs and vaccines is not just the active ingredients, but some of the stabilizers or other things that are used to keep the vaccine usable for any period of time. And especially in the heightened age of allergies, like you just mentioned, egg allergies, this is a concern for people. A little bit ago, people were very concerned about specifically mercury and thimerosal, which is a stabilizing ingredient in many vaccines. The difficulty was that there are different types of mercury that can be metabolized in your body. And the one that we know about, methylmercury, and this is getting a little technical, it can be very dangerous for humans in higher quantities. And this is why people pay attention to what's in fish, for example. This is where we see most methylmercury. Ethylmercury is really what we're talking about with thimerosal, but there isn't a lot of data surrounding about how that would be in the human body. So when the FDA is looking at what to say about it, they didn't have a lot of information. It's not believed to be very bad, but they wanted to be very conservative and say, well, let's assume it might even become close to being as bad. Let's just do away with that. So thimerosal-free vaccines really come from the fact that we want to protect against anything that could eventually be metabolized by our bodies to be harmful, although in fact, it doesn't appear that even that was that harmful.
So in our offices, we are administering the preservative-free vaccine. You can ask, when there's a bottle of vaccine that has 5 doses and you have to keep drawing them out, you have to use preservative. The ones that we use are each in their own separate prepackaged syringe without preservatives. So even though we don't think there's any danger, and there have been studies to look at the fact that there doesn't seem to be any danger, we figure why ask the question, so we use preservative-free vaccine. Marlene, you have a comment as well?
Yeah, one of the questions that patients will often ask me when I'm counseling them about vaccination is they'll often say, Dr. Miller, do you get vaccinated? And what I tell my patients is, yes, I get vaccinated. I have 2 children who get their vaccinations on schedule. My spouse gets vaccinated. I counsel my family, my elderly parents, on the benefits of yearly vaccinations or appropriate vaccinations. And the reason is because I know how safe it is, and I know how effective it is in preventing a lot of the illnesses and diseases that could potentially harm us. I also do it for my patients. As a physician who's seeing pregnant women, the worst thing in the world would be for me to get ill and somehow expose my patients to this virus as well, to the flu virus or anything else. And so I make sure that every year on schedule, as recommended, I get my vaccination, and I make sure that my children and my family get it as well.
Dr. Kelly, I remember you had a family story about that, I think, if I recall.
Yes, I mean, I agree. My husband's also a physician. We all get our flu shots. I have 3 children. They all get their flu shots. My reluctant parents, even now, I've convinced to get their flu shots, even though sometimes people can be stuck in their ways. And I not only think that it benefits us as a community, but I've seen it in my own life. When my 3rd one was 6 to 7 weeks old, my 2 elementary school boys, in turn, one came home with the fever and tested positive for the flu. 2 days later, the next one, we're trying to keep everybody separate. And by the end of that week, my 6-week-old had a fever, and at the pediatrician, she tested positive for the flu. And I'm sure that every parent or non-parent listening to this can imagine how terrifying that was. Because as a physician, you see that lots of people recover, but the horror stories as well. So fortunately, my little one did very well. She had a very mild case of the flu. We were able to go home, and she felt better, seemed better within a few days. And I truly, truly believe that the reason she did not get very sick as an infant is because I was vaccinated as a pregnant patient, and my children were vaccinated, my husband was vaccinated, we all had milder forms of the flu, and that I was breastfeeding her as well. And I continued to breastfeed her to keep giving her those antibodies through her illness. So I feel like firsthand, I saw it.
I mean, that's so meaningful. I have a meaningful experience as well, which I have to keep a promise. In 2009, when the H1N1 epidemic came, and I was medical director, and my role, I went to visit women who were either pregnant or recently had delivered with the flu. And these people were really on death's door. They were in very serious condition and intensive care units with tubes coming out from everywhere and unresponsive and in a coma in cases. And I happened to be there when one of those women, and they all survived, thank goodness, woke up. And the next day I came back to visit her, and we were talking, and she said to me, "Doctor, please make sure that you tell everyone that they need to have a flu vaccine when they're pregnant, and tell them that my experience, and promise me you'll do that." So I'm doing that. So that's where that story comes from. So please get your flu vaccine. Anybody else? I really appreciate your participation. I just want to say that the best time to get your flu vaccine is by the end of October, because then the protection will carry on through the end of the flu season in March. It lasts for about 6 months. If you're pregnant, you'll be able to get a flu shot during your regular visit at your prenatal care visit at your Women's Health Connecticut provider. If you're not pregnant, because we have a limited number of doses, you can get it through your primary care provider. You can get it through a pharmacy like CVS, Walgreens, Walmart, and other pharmacies. And also you can get it at an urgent care center. So I want to thank everybody, Drs. Abner and Dr. Miller, Dr. Kelly and Dr. Falter for their participation tonight. If you have any further questions, please call your Women's Health Connecticut doctor. If you don't have one, please make an appointment. You can find the number on our website, and you can be seen at the office or by telehealth with one of our providers. Stay safe, stay socially distant, and wear your mask. Thank you very much.